insane because the GLP-1 patches are buy 3 for $30 and free shipping, but only while that coupon.
These are not GLP-1 patches. They do not have any sort of glucagon-like peptide in them. I have two main questions to answer here. One, do these products work to result in weight loss? And two, is transdermal administration of these supplements going to be feasible at all? So of the supplements included in these transdermal patches, there are two that have more evidence than the others, most notably cinnamon and berberine. They both show modest clinical efficacy. Berberine can suppress appetite, improve insulin sensitivity, and prevent fat formation. Of note, this has been studied mostly in oral intake, about 500 to 1500 milligrams per day. And that can be divided in 2 or 3 doses throughout the day. Kind of to contrast that though, berberine is known to have poor oral bioavailability, which basically means when we take it in, the body doesn't absorb the berberine very well through an oral administration. It does sound like there is some studies on transdermal use of berberine, specifically with microneedles and hydrogel films that might have some positive outlooks long term compared to oral formulations. Cinnamon as well, some small but technically statistically significant impact there when it comes to weight loss. This is in pretty decent doses, 2,000 milligrams or more per day, and taking that at least 12 weeks. Unlike berberine, cinnamon doesn't seem to have been studied really with transdermal administration of the supplement, so whether or not you're actually getting any of the cinnamon through these patches is a question mark. Of note though, it has low lipophilicity and a large molecule size, so absorption through the skin may not be super feasible. And pretty much all the rest of the supplements that are in these patches don't really have much evidence to support use for weight loss, and they also haven't really been studied for transdermal delivery. So, might these patches work? Maybe. They might cause some weight loss through the mechanism of the transdermal absorption of berberine. But are these GLP-1 patches? Absolutely not. If you are going to use these patches, I would suggest discussing it with your healthcare provider and always being mindful that herbals and supplements are not regulated, so they can make high claims without any proven evidence. So be cautious, don't waste a lot of money. Follow along for more pharmacy and healthcare fun facts.